Million-dollar babies is a term coined in Alberta to describe children born with fetal alcohol spectrum disorder, a condition that has long been shrouded in guilt and secrecy.
Dans sa série émouvante d'une semaine, le journaliste James Hees de la CBC a présenté aux auditeurs un aperçu intime des défis que doivent relever les enfants et les adultes qui vivent avec ce traumatisme cérébral souvent incompris.
Every day in Alberta, a baby is born with FASD, and because their brain injury lasts a lifetime, it can cost the government more than $1 million to give them the support they need.
Children are often screened while in school, but for adults, getting an FASD assessment in Edmonton isn't easy.
Well, to be honest with you, there isn't a whole lot of funding sources out there.
Paul Pringle works with FASD adults. It's his job to get them assessed so they can get the help they need. For 5 years, he's been knocking on government agency doors looking for money to pay for those assessments.
And some agencies don't even acknowledge it as a brain injury.
It's really hard when you can't see the disability for people to understand that there's a disability there.
Christian Beaulieu points to a computer image of the inside of the skull that has a maze of thin white lines running through it. He says these white lines are the wiring that connects different parts of the brain. You can't see them with regular MRIs, but with this special diffuser tensor imaging, you can see the children he's tested don't have as many connections as other kids. Beaulieu says if he can pinpoint exactly which parts of the brain are affected and which specific problem is associated with it, treatments can be developed to enhance those areas of the brain and perhaps lessen the effects of FASD. Professor Jim Ryan is on the governing council of the federal agency paying for Beaulieu's research. He teaches at Queen's University. He says once those treatments are developed for FASD, there could be spin-off benefits for people with other disabilities.
Attention deficit hyperactivity disorder, autism spectrum disorders, brain injury resulting from some traumatic event.
Now that Christian Beaulieu has funding for another 5 years, he's looking for FASD teenagers who want to be part of his cutting-edge research. James Hees, CBC News, Edmonton.